Center for you to see Dr. Michaels.
It all starts with a dream about becoming something more, about doing something special, about making the world a better place. It can take a long journey and a very long time to turn a dream into a reality. And the journey to becoming a physician is a very long one indeed. Reaching that final destination takes unshakable desire and dedication. And it takes even more than that. It takes a lot of money. For thousands of minority medical students, a critical part of that money has come from the only private organization dedicated to making their special dreams come true.
You know, it's a long journey from there to here. And a big part of it is medical school. There are two things about med school that never change. It's never easy and it's never cheap. For most students and their families, it means taking out big loans and winning as many scholarships as they can. But even that combination rarely covers the full cost of everything. But what if after you scrape together every cent you can, it's still not enough? What if you're a talented African American, Latino, or Native American medical student with very special dreams and very limited resources? Where do you turn?
You know, I came from an extraordinarily poor family. There was never money for anything. So the likelihood of me being able to go to college, much less medical school, was extraordinarily remote unless I received substantial aid. And the monies that I got from NMF made the difference for me in medical school. I could not have made it without that type of financial support.
For more than 60 years, NMF has been driven by a single belief, that the health of all Americans is improved when talented minority physicians enter our healthcare delivery system. And that's why NMF has done one thing better than any other organization: generate critical funds for minority medical students. We do it all with help from people like you, individuals and organizations alike. In fact, through your generosity, we've been able to award more than $39 million to more than 28,000 promising students. But there's so much more to do.
Three important facts. One, we know from countless studies that minority populations on average have less access to health care and often receive a lesser quality of health care. Two, this is happening despite the fact that talented minority physicians are more culturally sensitive and more likely to dedicate themselves to the needs of minority populations. But here's the rub. Three, there just aren't enough minority physicians. In fact, the ratio of minority doctors to the minority population has actually dropped in the last 10 years. You put all that together, and it makes perfect medical sense and common sense to help promising minority medical students. That's why NMF makes good sense. We're all about success stories, helping promising students who come from very little and who through skill, determination, and with a little help from their friends go on to make a major impact on the health status of our communities, our nation, and our world. Believe me, a minority doctor can make a major impact. And what NMF does is so important that if it didn't already exist, we'd have to invent it.
A minority doctor can make a major impact.
Recibir una copia de cualquier información.
I grew up in the Bronx, and I was very interested in coming back to New York City to go to medical school and wanted to stay in New York to train and to work. For a lot of patients, having a physician that is from your background, knows your culture, can speak to you in your own language, is really irreplaceable. I cannot tell you how many times, even from the first day of internship, even in medical school, when I walked into a room and a patient said, "Ay, qué bueno que tú hablas español." Oh, thank God you speak Spanish.
There are great disparities in our healthcare delivery system, differences in who gets what kind of care, how much care they get, and how much it costs. These are problems that have been growing worse for decades now, and there are plenty of opinions about how to solve them. But while we try to reach a consensus on the big picture, we can't lose sight of the things we can all do here and now to improve healthcare delivery. The simple truth is, no matter what the big solution eventually looks like, we're still going to need the best trained doctors to serve every segment of American society. And thanks to organizations like NMF, even while we're tackling the problem, we can still be part of the solution.
Today it takes about $250,000 to educate a physician. Now consider this. The average medical student will graduate about $160,000 in debt. Paying off that debt is a tremendous burden for any new physician, and one that will only increase as the cost of medical school continues to rise.
For many talented minority students with limited resources, medical school can still be an impossible dream. We can't afford to let their dreams die.
What would it be like without NMF? How many of those 28,000 students would never have made it through med school? How many hundreds of thousands of lives would never have been touched and saved? How many cures would not have been discovered? How much more disease would there be? And how much would it add to the nation's health care bill? How many young children would never have that special role model? The one that encouraged them to pursue their special dream.
Martin Luther King said it best: the time is always right to do what is right. Supporting national medical fellowships is right. So ask yourself, how much is it worth to keep the dream alive? How much can you give for them, for us, for our future? Thank you.